This is a special Your Voice, Your Future virtual town hall, COVID-19 in Maryland.
Now, your questions for Maryland Governor Larry Hogan.
We want to thank you all for being with us. We want to thank Governor Larry Hogan for joining us as well. You're not only the leader of Maryland, but also the chairman of the National Governors Association.
And we got hundreds of questions from viewers. First, we want to ask Governor, how are you and your family doing? You're a cancer survivor. Are you nervous about your own health?
Well, thank you very much. Thanks for asking, and thanks for giving me this opportunity to try to answer some questions. I'm not really nervous about my own health. I mean, I'm being careful and taking all the advice I'm giving everybody else, but I'm doing fine. My family's doing great. I'm a little disappointed I don't get to see my kids and grandkids as much as I normally would, but we've been able to do a little FaceTiming, but we're all doing great. Thank you for asking.
You have been on the go nonstop, and we appreciate you taking the time for us. Now, we got hundreds of questions when the word got out that we had you, so let's get to them. Question now from Ann. This is the first one. She says, the numbers have spiked from test results suddenly appearing. Are you concerned about this?
Well, we are concerned about, I've been saying for several weeks that we're about 2 weeks behind some of the other hot spots like New York and New Orleans, and we're on the rise. There's no question about that. I've been sounding those alarm bells, and we are going to continue to see the numbers rising. But a little bit of this is because there have been backlogs in testing from private labs around the country. And so yesterday we had a huge spike with over 1,000 cases. A lot of that was catching up from old numbers that they kind of cleared out of their pipeline. And so today we were back down, still a rise. We still are climbing. So we're concerned, but it was a little bit of an anomaly with the giant jump we had yesterday.
Governor, let's dig deeper into those numbers. Maryland just started releasing the breakdown of coronavirus cases based on race. How will the state use that data to help communities that are disproportionately impacted?
So, Maryland has a large minority population, and it's in our larger population centers where this is obviously a problem, and you've been hearing about this across the country where there is a racial disparity, that people of color are getting the disease at a higher rate, they're being hospitalized at a higher rate, and we have a higher mortality rate. This information was not easily and readily available because it wasn't being collected by the CDC or any of the private labs that are all across the country. So I ordered our health department to actually do forensic testing and digging into this, and they had to research each one of these cases. So far, we've been able to collect about 75% of the data. We're still trying to get all of it, but it shows the disparity. I mean, look, we've got people all across the state, but in the Baltimore-Washington corridor, including Prince George's, Montgomery County, all the way through to Baltimore City, that's where the highest concentration in numbers are, and there's definitely a higher percentage in the African-American communities.
Just a quick follow-up there. Does that mean you'll put more testing sites in those communities?
Well, part of the reason is we actually are doing far more testing in those communities. So Prince George's County, we've done the most testing. They also have the highest numbers. Baltimore City is where we've done the second highest testing. They have high numbers. We're doing a lot of testing in Montgomery County. So some of it is we're doing a lot more testing. Some of it is there's a higher population and a lot more density. And some of it is that disparity that we've been talking about all across the country.
All right, get back to our viewer questions now. This one is from Wesley. When will the process for filing unemployment be fixed? Wesley says he has called 1,000 times and people are waiting for hours in line and they're just not getting any satisfaction. I mean, clearly the system wasn't built for this kind of influx, but is there something being done to streamline this process?
Sure. Well, Wesley, I'm really sorry you're having those difficulties, and every single person that's not getting handled immediately frustrates the heck out of me. I can tell you we're working really hard on it. We have had 140,000 claims filed in just a several-week period. That's 40,000 more than we had all last year. We've been driving people, trying to get them to file their claims online. We have 95% of the people who have filed their cases have done so online, and they're completely done and satisfied. We had to upgrade our online capability. The federal system that we linked into was crashing. I got the president and the federal administration to fix that problem that we tied into. We still have a problem with people trying to call on the phone because we're getting about 2,000 calls per hour. We've tripled the number of people. We've lengthened the number of hours, but there's only so many calls that you can handle at the same time. So I apologize. We're trying to do everything we possibly can to get that fixed, but it's a huge volume of more than a year. It's a year and a half's worth of claims in a couple of weeks period of time. But if you can, if it's at all possible, try to go online and file your claim or send an email if you can't do it on the online system, because the phone calls are going to continue to be difficult. And we're trying to fix it, but you can only answer so many phone calls at the same time.
And Governor, we want to stay on this topic because it was a big one. We got so many questions on this. Shell says the unemployment numbers are massive. The backlog means people haven't gotten checks yet. So she wants to know, when will people start getting their unemployment checks? When will they show up?
So one of the great things, a few states where you don't have any wait. Some states you have to wait 2 or 3 weeks before you can process a claim. In Maryland, you can do it the very first day. As I said, 95% of the people who have filed, of those 140,000, have been able to do so successfully online, and they get their claim immediately. Those checks are already in the mail and on the way. For those people that I understand the frustration, I don't want one person to not have it, but when they do either go online or finally get their phone call handled, hopefully it'll be really soon, they will get their money all the way back to the very first day. Nobody's going to miss 1 day's worth of payment, and so we're going to get them out to them as fast as they can. There's going to be no delay, and you won't miss a day's worth of work, of payment.
Now, I know you're in the middle of all of it going on, so there's so many things, and you've got a lot of balls that you've been juggling with this thing. But, we got a question from Dawn, and she says, what is the new normal? How will restrictions be lifted? Will it be like the flick of a switch? When this does pass, what happens?
Well, Dawn, that's probably one of the hardest questions of all, and it's one of the ones I've been asking of really smart people, of our entire team and some really smart doctors, and we've been talking with our leaders at the federal level. I don't think it's going to be a flip of a switch. We didn't flip a switch and shut everything down. I declared a state of emergency 35 days ago. I've now instituted 35 executive orders almost every single day over the past 35 days, and we had to ratchet this up slowly and do more and more. It's probably going to be the same way on the way out of this, where we start to ease it up and let more and more things open, get people a little bit back to normal. And we want to get things back to normal as quickly as we can, but what we don't want is to have that spike go up and have thousands of people die, have tens of thousands of people infected by doing it too quickly. So we're trying to get the best advice we can from the doctors and scientists. We don't have an exact date. We're going to do it as fast as we can. And as quickly as we can, as long as we're doing it as safely as we can. And you see all of this on the news. It's all over the country. Different places are in different spots. We're still on the way up. We're not on the way down. And so it's too early to do that yet, but we're watching this to make sure we can try to get back to normal as quickly as we can.
All right, Governor, this next question is from Scott. He wants to know, will the June primary be mail-in ballots or in-person voting? He wants to know, what will the process be?
So the State Board of Elections just came up with a proposal that is going to be primarily a mail-in ballot, which, in Maryland, we always have had anybody can do mail-in ballot at any time. We've been doing this for years pretty successfully, but most people still went to the polls. I think it's going to be the opposite this time, where most people do their mail-in ballots. But some polls, I think, will be open, because there's some people who either don't have post office boxes, don't have mailing addresses, they don't get a ballot in the mail, or some people who have disabilities that aren't able, people that are blind, for example, that need to go and get assistance to vote. So I think the proposal is going to be mostly mail-in with some provisions for other people. Our goal is to make sure everybody's safe, but also that we get a chance to count everybody's vote.
All right. Question from Heather. Where are we with testing? It seems to be confusing who can get tests and when. And that's a good question, because, a lot of folks at home watching the news, they see, NBA stars getting tested quickly, and yet here are folks at home in bed with symptoms not getting tests.
It's probably one of the biggest problems we have in America today. And as the chairman of the National Governors Association, this is a discussion I have with all of my colleagues. We have this discussion with all of the federal leaders on an ongoing basis. There's only a tiny percentage of the tests available of what we need. And it goes back to the earlier question about how do we get back to normal. One of the things we have to do, we have to be able to test a lot more people. Right now, there's only a small amount of testing available, and we can only use it for those people who are really sick, who their doctor has advised that they need to get the test. And the forensic testing we're doing to do contact tracing, if somebody has tested and they say who they came in contact with, it's not available widely to the public. It needs to be, and that's why we're at the federal level trying to ramp up all these production companies to get more testing. At the state level, we're trying to buy tests all over the domestic market and all over the world. We ramped up our testing considerably over the past week from where we were last week. We're ahead of many other states, but we're still nowhere near where we need to be. And it's a worldwide problem, but it's a particular problem here in the United States.
And just to follow up on that, do you have a forecast or an idea of when more testing will be coming in, like the test kits that come in? Because doesn't it make sense if you're going to go back to normal, people going back to work have to be tested before they go back?
Well, we're going to have to make sure that we don't have a bunch of people infecting each other when we come back. So the more people that are tested, the more people that are healthy, the easier it will be to get things back to normal. So the more widely available testing is, the safer it's going to be. So we've ramped up testing. We have even more testing coming in next week. By the end of the month, they say there'll be massive production of testing available at the federal level. We keep getting assurances from the federal level that there's going to be more testing. We're talking to all the private labs on a daily basis. So it's getting better, but it's still a long way off from where it needs to be.
All right, Governor, a lot of ears are going to perk up for this next question. This one is from Terry. What is the outlook for schools opening?
Well, that's a really good one, too, and unfortunately there's no easy answer. It goes back to the same thing about opening up the rest of the world and the rest of the economy, getting back to normal. I'd love to see schools be able to get back opened again. Right now, we're doing everything we can to provide distance learning in all of our school systems and provide laptops and tablets so that we can try to get people to continue the kids to continue their schooling as best we can under very difficult circumstances. And it depends on how safe it is and how good we are at tamping down this virus with the social distancing, whether or not the schools will be able to open. Some states have already made the decision to close all the way through the end of the year. We have not made that decision yet. We're going to give it another couple of weeks. Our state superintendent of schools has been working with all the county superintendents and all of the leaders in the local jurisdictions to try to figure out how best to handle the schools for the rest of the year. And they have several more weeks to try to figure that out.
I guess, Governor, what would be the signal that perhaps classes could resume for this school year? What would you be looking for? What would be the indicator for you that would signal, aha, perhaps we can go back to school?
Well, so we're all looking at this modeling, and you hear some of this when you look at the national level, but we have some really smart doctors that were saying if we did nothing, we would have, several 100,000 people become sick and really high death rates and an overloading of our healthcare system. All the things we're trying to do are to stop that from happening. If we can, because of all we're not yet sure how successful everything we're doing is going to be. We know we're making a difference, and we want to thank everybody for helping make that difference. We don't know yet, and we won't know for a couple of weeks, exactly how successful we've been. We think we're going to be doing pretty well. If we can tamp those numbers down, it means we get back to normal sooner. And so we're hopeful, but we don't want to just jump the gun and say, this artificial X date, everything's going to be great, and then have things spike back up and we have thousands of people die. That would just be a terrible mistake.
Does that decision right there weigh heavy on you for everything that you've got considered with businesses and schools and everything else? The loss of life?
It's a terrible decision. Yeah, it's a terrible decision. And we talked to really smart doctors, the top folks in our state from Johns Hopkins and the University of Maryland Medical System, from, all of our top hospital systems. We have really brilliant people that know a heck of a lot more than I do. And they talk about if we do these things, we can save lives, we can stop people from getting sick. If we don't do these things, really terrible things can happen where we don't have enough ventilators, we don't have enough ICU beds, we overload our emergency rooms, we don't don't have enough hospital beds. We're trying to build 6,000 new hospital beds to handle this surge. If we are successful, we save the lives of thousands of people. So we're making those decisions while also looking at, but people are being hurt economically, and they're losing their jobs, and small business people are being hurt. They're both terrible decisions, and we have to try to figure out how to save lives and then try to help people with the serious, economic damage. But it's a bad situation we find ourselves in, and we try to take care of both problems at the same time.
All right, we have another question from online. This one's from Melissa. She says, you promised massive aid to small businesses. When will checks be mailed?
So checks are already in the mail. We started a state program where we put $175 million of emergency money into our small businesses. That's already completely spent. We overloaded the system. We put more money in. Federal dollars have already poured in through the small SBA money that's come in. Today, Congress is arguing with each other about another $250 billion in small business economic relief. So at the state level and the federal money, and at the federal level, money is out. Some businesses are already being helped and have already received some, but there's a whole lot more help that needs to come. A lot of people who have not gotten help yet, and we're going to do everything we possibly can at the state and local level and pushing our leaders at the federal level to make sure that we help those small businesses and the people that work for those small businesses.
All right, we have a question from Frank now, and I know this is sensitive to you because I've heard you a few times talk about this. Frank says he sees a condo construction project going on, no social distancing by the workers. They're all piling in the truck together. So is that essential work?
So you could argue whether it is or it isn't, but the federal government put out a guideline, a list of what are considered to be essential businesses and what are not. Some of it, you can't sit there and make it I can't determine is this particular project an essential project or not, but I know there's a federal list that says construction is one of the essential businesses because some construction projects, I guess, are deemed to be essential. They should still be and are required to practice social distancing. So we have rules in place that allow any local health department in any jurisdiction to cite any business and any construction site that is not practicing social distancing, not following any of our 35 other executive orders, that they can stop them from working. They can require them to correct their behavior, or they can shut them down. So if you have those kinds of situations, you should report it to your local health department.
So earlier this week, the White House designated this Baltimore-Washington, D.C. corridor a potential emerging hot zone. Where do hospitals stand in Maryland? Do they have enough PPE? Do they have enough ventilators? And if not, what are you doing as governor to secure those resources? Are we going to end up in a position like New York where you're now outsourcing, asking for medical professionals to come here to assist?
So I spent about 2 weeks trying to convince the president, the vice president, the entire coronavirus task force, Dr. Birx, Dr. Fauci, the head of NIH, Admiral Giroir, all of them, that the Washington-Baltimore corridor, the region here, was going to be the next hotspot. As I was successful in doing that. As the chairman of the National Governors Association, I made that pitch directly to all of them. I was very pleased that they listened to that argument and that they have focused on us as a priority area. They've been bringing it up the past few days. So we now have kind of gone to the top of the pile. They can't help every single jurisdiction in the country at the same time, but they've said they're going to take their very limited resources and allocate them to the spots that are emerging as hot spots. They declared the Maryland, D.C., and Virginia region, in Maryland in particular, 12 of our jurisdictions and the District of Columbia as hot spots, and that means we should be getting at the top of the pile for some of these very limited resources. But the answer to the question is we don't have everything we need. We're pushing like heck, not only with our federal partners to get more. We have gotten some assistance from FEMA and from the federal government, which is much appreciated. We are moved up on the priority list, which is appreciated. But we're also, as a state, pushing all over the country and all over the world to try to acquire more PPE and more ventilators, more masks, all of these things that really, frankly, no state in America has enough of, and the country doesn't have enough of. And it's a very, very serious problem, which you hear about every night across the country.
You know, and it's scary to think about the frontline workers not having the essential equipment that they need, especially because it is life and death. And this leads us to our next question. This is from Val. She says, how should workers report essential businesses not providing masks and gloves? And we can talk about maybe supermarkets. You go into a supermarket, and some of those folks, you know, they legitimately are worried, and they'd feel a little more comfort if they had gloves and masks. And some of those stores are a little slow to react to that. So how do you report those kinds of businesses?
Yeah. So as I said earlier, so those kinds of things should be local health departments who are responsible. So if it's in whatever county it is, you should just call up for the health department in that particular county, or if it's in the District of Columbia, or if it's in Virginia, same thing. Call and make those reports. It's a little bit different in supermarkets. I mean, somebody just having any kind of a covering, any kind of a mask is sufficient. Having gloves, most of the large supermarket chains are doing that voluntarily and willingly. But if somebody isn't, they should be reported. It's different than the PPEs that we need for our healthcare workers, which are very specialized N95 masks, which are a much shorter supply. The kinds of things that you can use for businesses and for individuals to help us just keep, that are safe and keep us from spreading it amongst one another, those are readily available and people can easily access.
All right, this next question, Governor, is from Sherry. She says, as numbers climb, would you consider more aggressive action? So if we see that significant spike that we are seeing the projections show are likely to hit this area, is there a lever that you would then tighten? More restrictions? What would that look like?
So we have taken some of the earliest and most restrictive, most aggressive actions in the entire country. And it's hard to imagine that there are too many more things that we could do, but we're looking at things every single day to see if there's anything that we haven't done. As I said, we've done 35 executive orders in 35 days, and every time a new issue comes up that we believe we need to act on, we'll take that additional action. It's not always necessarily a new restrictive thing, but for example, we just had some outbreaks in our nursing homes, and we put together a strike force team made up of members of our National Guard with doctors and nurses from our local health departments and local hospital systems to send in to try to stop these things. So as we come up with a new issue or problem, we try to come up with a new idea and a new solution, because this is just a kind of a crisis that no one's ever dealt with before. And we're going to keep, trying to get the best input and the best ideas and take every action that we believe is necessary to save people's lives.
These are uncharted waters for so many leaders right now all across the country. All right, let's get to the next question. This is from Martha, and Martha asks, how are Maryland, D.C., Virginia working together to stop the spread? The coordination, it seems, has to be, integral to your minds because you're so close together. So if somebody's enforcing one really strict policy and yet the other one's not, which we saw with Virginia early on, so how is the coordination between the three areas?
I think it's been really good. So at the very beginning, of course, we were all just hit with this crisis, and everybody was taking independent actions as they saw fit. And I maybe came out and took action a little bit faster than some of the neighbors. But I'll tell you, not too long after that, everybody got pretty much in line. And we've had really great cooperation and great communication. We've had numerous discussions and meetings with both Mayor Bowser and Governor Northam, and I think we're very well coordinated. There might be a little bit of difference in one policy versus another, or in the exact timing of when one of us does one thing or another, but I think we've been on multiple phone calls together, and we've really been trying to work together as a region, because so many of our people live in one jurisdiction and work in another, and we're all very much interconnected. So that regional cooperation has been essential, and I think it's been really good.
Governor, our next question is from HODA, and this is something you actually touched on. Maybe we could go a little deeper on this one. HODA says Maryland's first deaths were in nursing homes. What's being done to protect seniors? You mentioned that strike team that you put together. So once that's in place, do you think enough is being provided for senior centers?
So one of the very first actions I took more than 30 days ago, we knew that we had a vulnerable population with our older citizens, both in nursing homes and assisted living facilities and senior centers, senior homes. And so we brought in the entire long-term care community, people, the leaders in all of that industry, and got all of their input, talked to them about the issues and problems, and then we instituted really strict guidelines. We eliminated visitation, which is really hard because we said you can't visit, your grandma, and it's a difficult thing to do. We also made it really strict. No staff members could do any outside travel. We made sure that everybody was being checked. Only staff members could get in. They had to have temperature checks. In spite of all those kind of very early actions more than a month ago, we had all these outbreaks. So no one was coming and going but staff. They were all being checked, and people were still getting outbreaks, but because we had asymptomatic staff members who were bringing the virus into the facilities. So we took further action and further actions, and now, so now we're sending in these strike teams to go in, because when you get an outbreak, we have about 90 facilities that have one case or more. But most of them are simply one or two cases, and we've been able to kind of stop it. But we have a handful of them that have really blown up. We had a terrible situation in Carroll County where we just had a rampant outbreak, and that's when we decided these strike teams were going to come in and try to stop these terrible situations. Virginia had a similar problem. Many other states have. And so it's impossible to keep everybody safe, but we're doing everything we can. These are the most vulnerable and the most susceptible, and the ones who we're having the most deaths with this particular part of the segment of the population.
All right, question now from Jennifer is, what's happening in the prisons? Would Maryland release prisoners? We've seen other states do it with nonviolent offenders or people who had maybe 1 or 2 months left on their sentence and they're just kicking them out early. Any thought going on there?
Yeah, so Maryland, prior to this, we pushed through a Justice Reinvestment Act, and we reduced our prison population more than every other state in America. So many of our nonviolent prisoners have already been released from the prisons. We also have been aggressively, stepping up those time frames for people that are, pre-decisional and speeding up time frames on short-term things. But right now, we've had about 18 incidents in our prison systems, which we're very concerned about. It's either correctional officers or contract workers, a couple of inmates, but we're concerned about kind of something breaking out in one of these populations. It's not nearly as bad as the nursing homes where you had 585 cases, but we're concerned about any of these times when you've got a population in one area where something like this could break out. But we've taken a lot of steps with respect to the prisons. I mean, we're not going to let out all of the violent prisoners out of jail, but we're taking every possible precaution to keep our inmate prison population safe.
And Governor, we want to squeeze in one more question here. This is from Greg. Is the federal government a partner in fighting the virus, or are they in your way?
No, I think they've been a partner. Look, I mean, as I chair the National Governors Association, we've had, I believe, 8 teleconference calls with all of the nation's governors, with either the president and or vice president and all of the top leaders of the federal government. We've put in about 15 different requests of things that the governors really needed help on. They've addressed many of those issues. We haven't gotten everything that we've needed, but there's been great cooperation. Look, the same frustrations you've heard about earlier. We don't have the PPE that we need. We don't have the testing that we need. But I don't want to point fingers and say whether the federal government should have done this or the state should have done that. I just say we're all trying to work together to fix some problems. But, I think they've been a partner. We're all in this together at every level, and it's going to take the federal, state, and local governments and the private sector and all the citizens out there watching. Everybody's in this to try to beat this invisible enemy and try to get back to normal.
In the final minute and a half or 2 minutes that we've got, a couple things. One that came out today, anytime there's a time of tragedy, there's always these despicable people out there that are trying to take advantage of it and profit from it. You've seen a lot of scams that are going on now. What's the warning that people at home should have about these kinds of scams and charities that are popping up now?
Yeah, it's really disgraceful. So you see the best in people and the worst in people. One of the most wonderful things is, even though we're physically separated, it's really brought some people together, and it's brought out the best. And you see some of these people volunteering and donating and helping their neighbors. We've also seen people scamming people and trying to take advantage of people in their time when they're afraid and when they're, So we're cracking down on all of those things, and it's one of the worst things as far as I'm concerned. So we're going to really go after those folks that are trying to take advantage of people in the middle of a crisis like this.
So the folks.
But we also want to thank all the wonderful people who have stepped up.
Oh, we have so many examples of that, and we're trying our best to do more of that in every newscast we have. Do you just want people to know that if something looks too good to be true, just ignore it, when they're trying to scare them and get some money out of them?
That's very true. Usually when it sounds too good to be true, it usually is.
All right.
Well, Governor Hogan, we certainly thank you for your time. We appreciate you spending about 30 minutes with us. We definitely know it's appreciated by our viewers as well. We look forward to talking to you again soon.
Well, thank you so much for taking the time, and thank you.